Today, the 22nd of May, 2020. We want to talk small about the multi-system inflammatory syndrome and picking them from COVID-19. And with doctor in the house, Dr. Isatu Kakay-Diallo, now can break that one day down for we. But before that, make we go straight into the status update for today, the 22nd of May. This now waiting the government of Salone tell we. We get 21 new cases. 21 new cases. 21 people na then test positive for COVID-19 na Salone. And the 21, if we break and down by district, we get 15 from Western area urban. 15 from Western area urban. We get 4 from Putloko. Yes, Putloko, it be take small relief with 8, but now they don't get 4 added. 4 from Putloko, 1 from Moyamba, and 1 from Kailao. Naingi 21 new cases. Make a go back again. 1 from Kailao, 1 from Moyamba, 4 from Putloko, and 15 from Western area urban. We give it 21. And they also be want to make we know say now 185 samples them now then conduct test on. 185 samples. And out of the 185 samples, 15 say they get for do a rerun on 15. We then get for do them again. And then they'll say na rerun, and so because of that, then still depending. So tomorrow, I think say then 15 then they, if they negative, well, but if they're positive, we go likely see say maybe tomorrow I won't go day up, even though na 185 samples then collect, then do test on. And the confirmed cases cumulatively don't reach now to 606. 606. From the 31st, we'll get our first case. We then begin test na Salone. To today, the 22nd of May, they don't test 4,848 tests, then they don't conduct. 4,848 tests. From the first day we then begin conduct tests to date. And out of that day, we all know say we don't get 606 positive cases. The people in isolation right now, na 338. In isolation meaning, then people then they respond to treatment or any you put her now. Na 338. The one them we don't recover, the one that we don't beat COVID-19. For today, we get 25 people we beat COVID-19 na Salone. 25 people So because of them 25 people they don't care the total cumulatively, the total number of people we don't beat COVID-19 na Salone na 230. 230. I think we're doing good that side. However, we come to the loss of life. We come to death through COVID-19. We get a total of 38 today. A total of 38. Now we get today. We may come 3 new deaths now recorded. However, when they give you the breakdown, they say a 57 years of age person from Connaught Hospital, a 70 years of age person from Connaught Hospital, and a 59 years of age from Bombali. And then we want to make we know now say, yes, let me say not for call him, but Dr. Minkailu Ba will be lost in life. He has been recorded now. He has been recorded, so then continue number, but then 3 people there. Where now your number recorded from Bombali. The people in quarantine right now are 2,118. 2,118. And the people out of quarantine are 3,065. 3,065. If we say with the breakdown, the one them way don't get COVID-19 positive by gender, 290 female and 316 male. If we want for breakdown down again by district, Bo 25, Bonth 13, Bombali 14, Falaba 4, Kailaon 14, Kono 3, Kenema 24, Koinadugu 2, Moyamba 5, Potloko 12, Pujeon 2, Tonkolili 6, Western Area Rural 46, Western Area Urban Freetown 436. But standing at the cumulative numbers them. I think say we go bring Cam Isatu first, make we deal with Sunday and see the time, and maybe just after Isatu we go talk small, but the face mask we hear say enforcement go begin, and not just say enforcement, they say rigid enforcement. But it will surprise you for no say, na the Sierra Leone Motor Drivers Union, na den pull lawandi, for say rigid enforcement. But maybe we go rub more small where we left Isatu. But for now, would they bring the doctor in the house, Isatu? They can't tell me about the multi-system inflammatory syndrome, where they see now by picking them, where now from COVID-19 related causes. Make we bring Isatu. Yes, Isatu, you get the platform.
Hi, good evening, everyone. I hope everybody to do well, and every day with the number of cases, we ask ourselves where would it go wrong and what we can do to make sure them things get better. But as AAA already don't mention, today we want for touch based on, the multi-system inflammatory syndrome. Will it happen? Will they come in we picking and they get due to this COVID-19? So first let's find out what's in this multi-system inflammatory syndrome. Really happen with picking them. So it's a rare, now something we're very rare, meaning they see so easily, but now very serious condition we then don't associate with COVID-19, the coronavirus. And then report this now picking their way now Europe then they and also now North America. So some of the features and some of the things that we will see panic picking is similar to toxic shock syndrome. So back like about 2 months ago in the United Kingdom and Europe, then get some link we then report these features and say they don't observe picking them with inflammatory syndrome or inflammatory effect based on their blood count, based on the symptoms and what they present with. And also, now around May 5th here in the United States, they been get about 64 cases for picking them, where been get COVID-19. But at the same time, the picking them na New York hospital now, so New York City, been get symptoms and where they present. And then they also call this inflammatory syndrome, say, na pediatric hyperinflammatory syndrome hyperinflammatory shock. So then we're going to routine a shock and routine the inflammation will take place with the kingdom. So first of all, routine a shock. Shock now a condition where we say, the body, they lack adequate amount of blood flow for the tissues them and your cells them where your body need for make sure say you will function properly. The body need oxygen, the body need nutrients for make sure say you system, you organs then they function adequately. But if you lack that blood flow to the tissues them or to the cells them, and then the heart, they pump enough blood, so we think it happen, it lead to shock. So sometimes and then now, because of that shock, it lead to, some symptoms and when they manifest. The blood pressure can become low, the heart rate can become high or low, and shock can affect anybody's system. So that's not something where we need. So one of the main components is now because there's been impaired, meaning that, something when they work, the body they pump enough fluid, or blood into the system that we need. So because of those reasons, it lead to a cascade of events, different things that would happen, to the body. So for that reason, if any injury or any insult or virus take place in the body, it cause this shock or let it happen. So these are some of the features then we can come up with this multi-system inflammatory syndrome and the kingdom. So then, the different types of shock that we can present now cardiogenic shock, meaning the heart. Now the heart not pump enough blood because there's impairment or there's a failure, meaning there's a pump, failure, or like the contraction that happen appropriately. And that can lead to shortness of breath. The person, they become very cool, their skin, they become very cool and clammy, especially their hands and then feet them. Sometimes they can lose consciousness, and at the same time, you can see them, the neck vein can become very big, and then also the urine, they make enough urine output. So that's not all for tell you, say your heart is very essential in how you deal with, you live. If you had not a pump, so many organs then they become affected. So then get other one called septic shock. This one is due to infection. So if you get like a bacterial infection in your blood, it cause septic shock. And at the same time, then get other shock when they call neurogenic shock. Maybe say this not because, the sympathetic nervous system, meaning there's a problem with the spinal cord, which could be, say, due to an injury where you get from a trauma or you get because of spinal cord, you fall down, you broke your spine and things like that can lead to then kind of shock then they. And then shock then they can eventually lead to hypovolemia, meaning you get low blood volume. Maybe say now your blood pressure will go low, you become dizzy, you present with different symptoms then. So definitely what can happen, is rare, but in many cases now life-threatening complication then which can lead to death if they not take prompt action. So then, some of the features then we can present with multi-system inflammatory syndrome, now persistent fever. Where these are the same symptoms who they see with them will get COVID-19. Abdominal pain, meaning them belly the heart, they can get they can want to throw up, which is gastrointestinal symptoms, like they want to throw up, then they feel nauseous, or they can vomit. And also their blood pressure become low, at the same time, they can get some neurological, meaning their mindset not to the same, can become affected. As well as if you check their kidney function, then get problem with the levels, then we then do the blood test, it shows there's elevation of the, renal function, studies. And when we say like then will begin, they release just very little urine output, they're not going to produce that much. So then syndrome there, so, it overlap with childhood illness, what they call Kawasaki Disease syndrome, or Kawasaki disease. We'll go into a little bit later on as we continue. Some of the labs then we can become affected as well. Now, the C-reactive protein, then they tell you there's inflammation. First of all, what's inflammation? Inflammation are like a swelling where they take place within the body. So then they become inflamed. We check the markers, then they elevated. The D dimer, what I mentioned the last time, the D dimer can become very high, over 500. So when they over 500, then so we need to put them on a blood thinner to make sure they do not develop blood clots. So then so you can see that they all elevate, they're all high at the beginning. So then sometimes they not even get some respiratory symptoms at this moment, but then just similar that Kawasaki disease. And in some cases, then they do the COVID-19 test where they say it can become positive, via blood or not positive at all. But at the same time, even though because it's positive, they never see any other pathogens, meaning any other infection within the blood. Now, the only thing that they see now the COVID-19, when are the SARS-CoV-2, when are the virus what they cause COVID-19. Some of the clinical manifestations then, usually they say a mild, but, in severe cases, they don't report them and they, we begin. So the most common symptoms we don't observe and begin then are cough and fever. Even though some beginning can report, say, they get sore throat, then they feel tired. Their nose, they become congested, they can get diarrhea and vomiting. So, but other symptoms then with them, we don't report as well with this COVID-19. Now, then they feel like, say, then they shake, their body, they shake, then they get headache, also they get new symptoms where they say loss of taste or smell. And the other thing, they can get rash. And when they do chest x-ray, it can also show, say, either the person in x-ray, they come back normal, or it can demonstrate like consolidation where we say they get infection, at the lung. So for those reasons, they can take prompt action to make sure so they come in, then contact the ICU doctors and the pediatrician, then the rheumatologist, for make sure so they can able to deal with them, picking their problem promptly so that it not become a complication. And they do a study about 171 children with confirmed cases of SARS-CoV-2, which are the COVID-19 virus infection. And then the chest x-ray come back or shows that 33% of them and they get a ground glass opacity, meaning, that way you see with some COVID-19 cases them. And also, the findings, before the symptoms, it can be, before the can even present any symptoms. So, and then findings there are so like, they can see in about 7 picking them out of 8. Out of the 8 picking them, then 7 picking them become positive. So some people get a question as to, can SARS-CoV-2 be transmitted through breast milk? Because since we talk about Peking, we talk about anywhere from infancy to 18 years of age. So for the study, it shows say they not see anywhere, like if let's say the mommy not become in contact with anybody who get COVID-19, it not show any COVID-19 at the breast milk. But if the feeding take place, now a place where the exposure don't happen, then definitely, that can become positive of the COVID-19. So if the mommy do the breast pumping or the breastfeeding in a very clean environment, where we say and take all the measures, then, that breast milk, they don't see any COVID-19 virus in that. But if it happen in an environment we're not clean, we're not sanitary, definitely those are things that can happen. And the other thing was they want to know, this same study want to know about pregnant women with COVID-19, which shows say, the people that will get COVID-19 during pregnancy can do fine, unless young people that get severe underlying conditions, them, like if they get diabetes, then get high blood pressure, or then get asthma, it can increase their chance for COVID-19. At the same time, what I want for people to understand, just because you're pregnant, no means say your symptoms will become different from the person who's not pregnant. So then while the pregnant woman then take the same necessary precautions as the regular individual. So that includes the social distancing, the hand hygiene, disinfecting surface, and wearing masks in public areas. So that's not something we don't recommend for pregnant women. And also, then therefore, be very careful if they get small picking them. So picking them, can become asymptomatic or can get very mild symptoms. So for those reasons, if you get small picking at your hand, say the incubation period now 2 to 14 days, you have to take the necessary precautions. At the same time, the Center for Disease Control and Prevention, they recommend picking them. Not forget play date with any other picking where they outside their household. And if they decide for play with other picking, then therefore try to remain at least 6 feet from the other picking to make sure, if the other person get any virus, will come in contact with that. But at the same time, then for wear face mask for, make sure then they protect themselves and they protect the other person and practice the social distancing. The other question is, are children at risk of having severe COVID-19? Frequency of the disease in children, iboku, but just like Abidon mentioned, the symptoms can be mild to moderate, and the patient can recover within 1 to 2 weeks of the disease onset. So the patient, they do much better compared to the adult population. And then they do another case studies. This is not China, it takes place. So about 2,135 picking them, they included in the study. Out of that 2,135, 728 picking them get confirmed cases of COVID-19. About 55% of all them picking them, they get mild or no symptom at all. And then 40% of the case when I be moderate, the picking them being show, say they get pneumonia, but they not be get problem with breathing. And then 5% of that present with shortness of breath, some bluish of the skin. Like, so if you don't get enough oxygen, your skin will become bluish, what they call cyanosis, or they can get hypoxemia when like low oxygen in the blood. About 1% now then become critical out of that 728 picking them, where they say they then require respiratory support, and then be in like respiratory distress and also in respiratory failure. And then the last thing, which is shock, we mentioned. So because of the lack of enough oxygenation within the blood, down in 19 lead to that. And then similar thing, study being going again, about 376 infants then, where we say infants not less than 1 year of age, about 11% out of that 376 had severe and critical disease. So the finding then saying for be careful how you interpret them, because in many cases, them picking the also can get other underlying medical problem with a respiratory infection. As you know, picking the way they breathe, the way it is able for expirate, like, for cough in sputum or for spit out, able to do that fast now, big person or an parent can for do that for them. So you therefore be careful and see whether they get any other respiratory illnesses. So some of the potential risk factors for severe disease, as we don't mention, if the pikin get, chronic pulmonary disease, maybe say like moderate to severe asthma, or they get some congenital heart condition, it put them at higher risk for COVID-19, just like the adult population. And also if they get, like cancer, where they suffer from cancer, then they go through chemotherapy or then they get radiation therapy, then they also at high risk for COVID-19, as well as picking them we don't get organ transplant. And we they get like a steroid now medication when they give for decreased inflammation. So it can put you at risk for many other things. At the same time, picking them where they suffer from liver disease, we get kidney problem or we get diabetes, can also be at higher risk for COVID-19. And also, if the picking are considering we get body, like, get above, 95 percentile of the body mass index when they check for picking them, then risk is higher than picking we get normal growth function. We not get no underlying conditions or whatsoever. And some of the questions then here is the pathogenesis for, multi-inflammatory syndrome in children and the role of COVID-19. So they say it's uncertain about the Kawasaki disease, but the symptoms and way they present with them similar to Kawasaki disease. So as we go further, we will talk about which in a Kawasaki disease, which in other than they get them and which in they do for treatment in a. So the other thing what I want to bring up is now which in are the criteria, the diagnostic criteria for multi-inflammatory syndrome in children. The Center for Disease Control and the WHO, when at the World Health Organization, get different criteria. For CDC, when Center for Disease Control and Prevention, they require 4 different things that will happen. So one of the things that will happen, the picking or the patient will be less than 21 years of age. And then they forget clinical presentation of fever or the lab, we then do the blood test. It will show, say, they get some elevated inflammatory markers. When at the C-reactive protein, the erythrocyte, sedimentation rate, D-dimer, when at the one we show whether they get blood clot or then they're at risk of blood clot, then ferritin level, and LDH, and many others. So then forget at least some of them and they will be elevated for, let's say, the patients get MISC. So I try for abbreviation now, MISC. And also then forget no other diagnosis, not for present with them. For be say that we don't treat them for some kind of infection in the past, that will become an exclusion criteria. And also then for become positive via blood test that then get COVID-19, or they can do the RT-PCR when we see not through the nose, for make sure they confirm the disease. Okay. And then for the WHO, then get 6 criteria for the patient, for the picking them. The picking for days between 0 to 19 years of age. Then for get fever, we don't last for more than 3 days at 100.4 degrees Fahrenheit for more than 24 hours. And also then for present with at least 2 of the following, meaning then for get either rash or then they experience low blood pressure, or they can get some kind of, heart problem where they go on, then forget at least 2 of that. In the same time, then blood test for sure say then ESR and then the C-reactive protein is elevated with no other infection, meaning they not forget like sore throat, they not forget any conjunctivitis, then picking sickness, and none of them not for become positive. Not for be go on with the picking. So at the same time, the COVID-19 test for become positive. Go let them say, this person will get multi-inflammatory syndrome in children. So some of the symptoms, we then do a comparison between adults and children. Fever, cough, shortness of breath happen to be highest. Maybe say we know say those then are the hallmark symptoms for picking them. For COVID-19, are the hallmark symptoms. So if you get fever, you get cough, you get difficulty breathing, what they call shortness of breath, then the presence with somebody will get COVID-19. In rare cases, people they present with the symptoms because of their immune system can make them, fight off the infection as much as they can. And only way they don't become worse, and then it becomes something else. Then they will begin to present with symptoms, and we'll be saying, in those cases, if you really don't know, it can lead to, a bigger problem. And there's this graph, we then do a study in the United States from February to April. It shows, say, back in the beginning of February, there's not been getting no case, but from February 24th to April 2nd, the rate begins for increase from 0 to 2,500. So why this important? Because before we would be say COVID-19, they do, picking and they get harm and things like that. But picking and they get harm because just within this time frame, look how many picking and don't present with the disease. 2,549 cases from February 24th to April 2nd. This now a report by the CDC. So for those reasons, we need to be careful for those of us that have children, and also for say if the adults not take the necessary precaution, the picking and they also at risk for their COVID-19. Then do an age distribution to find out how many percentage of picking them are and based on age group. So anybody less than 1 year old, then group about 15%. Then from 1 to 4 years, then get 11%. Then 5 to 9 years old, 15. Then you get a 10 to 14 years old, 27. And then 15 to 17 was 32%. I think why this is important to know is as you get older, you risk for this COVID-19 is higher compared to the picking unless the picking get underlying medical condition, like cardiac problem with them born and with or some respiratory problem, then they are at higher risk or they get cancer. But if you can see the trend here, 32% from the age of 15 to 17 years old get, they are at higher risk, get COVID-19 based on the study we've been doing. So that's now a very important thing for all know, say, as you get older, your risk is higher. And then do another study in England, from the Royal College of Paediatrics and Child Health. So in the beginning, they say picking them be asymptomatic, and will present with mild symptoms of COVID-19 infection. But in about 2 months, they see a significant number of picking them will present with systematic inflammatory response syndrome. This is the topic we'll talk about today. So waiting at the reason because for this particular case study, then do the case study because then she say the case and the symptoms and they represent similar to Kawasaki disease. So Kawasaki disease is a childhood illness we can get. And what's in pediatricians then do. The moment you see a picking with then symptoms there, so before involve the cardiology because Kawasaki get a cardiac, component to it. And picking a need for see a cardiologist and also a rheumatologist as well, including the pediatric intensive care unit provider. So the reason for this is to raise awareness, for make sure say physicians and especially pediatricians and they able, identify the problem with the picking they present with and make sure say they seek the expert in your own consultation to make sure say they will treat the picking promptly or let the picking not go into any further deterioration of their condition. So similar thing will happen in New York because I also get a notification about, the new health advisory we come for pediatric multi-system inflammatory syndrome. We say, a potentially associated with COVID-19 for picking them. So within and while the clinician do is to make sure, say, once you don't, see all them physical symptoms and then laboratory markers there, so you reach out to the specialist and we will for take care of the picking for make sure, say, the picking no, lose their life through COVID-19, because prompt action and treatment really can help in how you manage somebody in problem. Some of the case definitions is how the picking present to you. the pikin can get any fever, then we get any elevated C-reactive protein, and also if they get any, cardiac or respiratory or renal, problems, then meaning, they can present with them features there. So then, say now one way for like begin to identify this problem they go on. And what I want the pediatrician then do for make an exclusion for make sure say this pikin not get any other respiratory infection or any other infection where they go on at the time. And at the same time, do the COVID-19 test for make sure say it's positive. When once you don't meet them criteria, then they're not for sedum, then for eventual, either for seek the appropriate, tool for take care of the patient. So where you can also, some of the symptoms then like the abdominal pain, conjunctivitis, cough, diarrhea, headaches, and also sore throat. These are some of the things then where you can see where they happen, with them in there where they come with multi-system inflammatory syndrome. And they also get like a priority in terms of either for test force and whatnot. Now, for going to Kawasaki, because since we don't mention Kawasaki disease, so Kawasaki disease now one of the most common blood vessel disease in the kingdom, and in something way very common, among Asian American, Asian kingdom. So whether in America then based or Europe then based, but them picking and they're more likely for get, the Kawasaki disease than any other descent. And the disease can last for an average of 12 days, and the pikin can get a fever for more than 5 days. And anyhow, something we get big complication we possible be worried about. We know the cardiac complications, and that includes, coronary artery, disease, some cardiomyopathy, which can cause, further complications. The complication can be significant because if we not take the necessary actions, it can lead to increased mobility and mortality. So mobility in the disease, the number of disease increase, and mortality when death, and then this can happen, in children, picking them with not treat on time. So that's not something we need for know. And if you begin see them symptoms there, so you can get rash, where we say going to this slide, like the picking and then don't begin to peel, and then it present with conjunctivitis, like the eye, the side can red, so, and they also get like strawberry tongue, where we say like the tongue get like some rash and also a red, and then their lip then can crack. These are then, and also their hand they can swell at the same time. There are also symptoms that pikin we get Kawasaki can present with. Then get diagnostic criteria for this as well. So according to Up to Date, the diagnostic criteria for Kawasaki disease will be fever that don't last for more than 5 days, with no other explanation. So they don't know why the fever they happen. They give Tylenol or they give Motrin to the pikin, or depending on what side they routine, then they call them fever reducing medication. Then they give, but they control the fever. And also the pikin get this conjunctivitis. The pikin also get these oral mucous membrane changes with the strawberry tongue, maybe it's a redness, of the tongue. And then also if anybody picture the strawberry itself, you get like dim, little spots them, around, on the strawberry. How the strawberry look now, so the tongue can look like, and also they can get lymph node, because lymph node, they only appear because if you get some kind of infection to go on, or you get some kind of cancer where they happen in your body, so now the finally you can get lymph nodes, so body can present with all them things there. So, like I said, geographical, genetic factors or environmental factors, people that we now from Asia or the Asian Americans, then they have higher risk for, Kawasaki disease. At the same time, the disease can happen if somebody get like exposure to mercury. If you expose to mercury, it can lead to Kawasaki disease and some of the causative problems and dandy. We've talked about. So some of the lab markers were also similar to the one for multi-system inflammatory syndrome. So the C-reactive protein and the ESR, when at the erythrocyte sedimentation rate, can also become elevated for patients picking a way get Kawasaki disease. And then urine output become very low. When you do them blood tests, the white blood cell and the platelet then can become elevated. And sometimes the patient can become anemic at the same time. Some of the things in this way can happen. And even when they do liver function tests, that can also become abnormal. So these are, make them say, is similar to a childhood illness where we don't see before. But when it happens, it affects different organs. So now we can call it multi-system inflammatory syndrome because not one system no more it affects different symptoms. But for this Kawasaki disease itself, the treatment here, the choice of treatment are aspirin and immunoglobulin. So then get a way how they can give this, which I not to say I will go into more in depth, but like now then treating and they can give the picking. The most thing we possible understand here, the treatment is effective if they use them within the first 7 to 10 days. So within the first 7 to 10 days, once they don't make the diagnosis, then they give the immunoglobulin along with the aspirin for make sure, cardiology is also on board for help the picking. Now I want to go back to treatment, or waiting they currently happen for COVID-19. Right now, they're not getting no drug whatsoever for treat COVID-19. But however, the Food and Drug Administration, don't approve a clinical trial drug, what they call remdesivir, which is an antiviral medication, where they go on right now for people that will get severe COVID-19 or with it in a very critical state. To anybody no more to get them, because you get mild symptoms, so then we give this remdesivir, this antiviral medication. Now, only for those where they in a very critical state, and then we go through this clinical trial, and then they recruit for. So if you go, if you're really interested, you want to know about some of the clinical trials, then when you go on, about COVID-19, you just, go to clinicaltrials.gov, and then you can read a little more on that. But I want to briefly talk again about, phases of clinical trials, because since many people have been done, they talk about the Madagascar COVID drug, and we don't really get any clear guidance as to why this drug is effective, as to why this drug is needed for helping them with COVID-19. So phase 1, for clinical trials, and get about 4 phases. So the first phase, it can last for several months, but less than a year. So what they make them, they do this study. They can enroll very few number of people, about 20 to 100 healthy volunteers, for their part of the, the study. So since the study they last for several months, the reason is to know whether the drug is safe and the dose within the D is effective. So whether them 100 up to them 100 people, so we now volunteers, then we don't decide for going to the study, about 70% of the drug can go to the next phase, when at phase 2. Then the ink can last from several months, to, 2 years. So at this point, they can give the same dose, but they want to know whether the medication is effective and looking at some of the other side effects with the patient, the problem they present with when they take the medication. So about 33% now, at this point, 33% can go on to phase 3 of the trial. Now, with phase 3, they get about 300 to 3,000 volunteers. We can get the disease. They actually get the disease for the medication when they take or the condition. So then it can last from 1 year to 4 years. And at this point, they want to foresee the medication is effective, and also they want to monitor any adverse effect. What's an adverse effect? Adverse effect not anything where you not intend forget where you take a medication. So you can see some people can get allergic reaction to medication once they get any medication, then tongue is swell, then face is swell, immediately you can see then they stop the medication, and give them something for counteract that effect the way now, like sometimes they can give them Benadryl or give them epinephrine, depending on the setting inside the person, where you get the allergic reaction. And just for know, sometimes people can lose their life in them clinical trials there. So not a big number, but like it can happen. And they can also report that. So you can see when you pick up your medication from the pharmacy, you see all the side effects there. So, but by the time you don't read the side effects, you even discourage if you really want to continue to take this medication. But not to everybody they experience the side effects, because everybody in body, they respond to something differently. And then at this phase 3, the FDA, when at the Food and Drug Administration, can approve the medication for let it go into market. And then now you get a comparison of this new drug with other drugs, and we don't take place, for see which one better in terms of percentage wise. How many people then we take and we do well with the medication with this trial, and how many people then take the other one. So you can see now that the drug company that can market na TV for say on clinical trials about this percentage showed effectiveness or improvement, while on this particular medication. So now some of the commercials, and then if you can listen, they can talk about them percentages then for market the drug, so that people can go and tell them, provide us a change drug to this. And then the phase 4 ended now for several volunteers to continue the study for see how safe and how effective it is. So that's not the only thing we get problem with Madagascar, COVID-2 drug. So until we get them in place, because this problem just start in December. So we talk about several months to a year for phase 1. And then we don't get any data for support. What thing then they do? If we get data for support, then we can try for say, then we don't do a study. This amount of people then been take this drug, but at this dose, then get a very small dose, maybe let's say 10 milligrams or like 1 cup, or let's say 1 teaspoon, or tablespoon, like 15 ml, then don't drink that. Then people then do well after taking this drug for like 2 weeks. So if you're able to provide them data, then person can say, it makes sense for us to go with this particular drug. So I feel I just want to bring that in, because since even with the remdesivir, when are the antiviral medication, pediatric patients are also not candidates for that drug. As long as they're not like in the critical and the severe, illness route, meaning not to mild, moderate disease, but like severity is very high. So it makes sense for you try them this antiviral therapy to see how best they will do with that. So, and that's another recommendation for this particular trial. So remdesivir, I just want to talk about what in this drug they do. In an HIV drug, maybe say it only out there, and the HIV patients, and they take them, then they do well with them, and so they still say it can do well, with COVID-19, itself. And then also what in and notice is, like I said, they do a case study for adult patients, then it shows say the medication being beneficial for the patient, then we take and then tolerate the medication very well. So the mechanism of action for this particular medication is like, a pro-drug, maybe say they metabolize, some biologic factors, as well as, it acts as an, anti-arrhythmics, for irregular heartbeat. And we say some of the complications there, or the things that we deal with now, the one that we get, underlying cardiac problems. So this drug can work on that. where we say it can cause a delay in the chain of termination during the viral RNA replication. At the same time, it carries some kind of viral genetic information, where we say, the way the virus and they replicate, it can attack that or stop that constant replication of the drug. So now the function of the drug, now what it do. And what I want, again, for all know about this drug is like there is no specific drug-drug interaction data available, meaning they interact with any other medication. So, that make it very good for let you use the medication compared to some drug then they say let you take them. But we take them, but if you can't take other medication, it cause interaction. So we cause that interaction, it can lead to, some kind of side effect where we say, good for the patient. And another thing we need to know about this remdesivir, now something where you need for the monitor a baseline liver function as well as the blood count. We know the, CBC, the kidney function, you need for monitor and the, for where somebody they start this. So baseline meaning then for do a blood test before the person didn't take her. So while then they take them back, then for they do the blood test for make sure that then they monitor then kidney function, they monitor then liver function, as well as then blood count. And the way the medication they excrete, they leave the body, they leave the body through the urine and feces, about 74% now through the urine and 18% now through the feces. So some of the warning or precautions then for remdesivir now liver problem. That's why they make you get for test the blood test for see what's in the causing in liver function. If then they take the medication because the liver really what's in the function of the liver, then they metabolize many medications them. So they take so many medicine, liver and at the highest for metabolize the medication. We don't get through the GI tract, and then then you deal with the kidney. The kidney are the second one. So then two labs and then lab markers them is very important for monitor with the person depend this. So if somebody already get liver problem and they already get kidney problem, you therefore be cautious in dosing, in how much then you feel so the person will take when they take remdesivir. So, and also when you don't they monitor the labs, if the liver function don't go higher than 5 times the upper normal limit before discontinue the medication, and try for monitor the patients for see how you stabilize that condition. So, as we mentioned, this now the FDA now issue this as an emergency use authorization for the investigational antiviral drug, for the treatment for people who get severe COVID-19. So as well as the patient then when a pediatrics patient then self-is then at the severe category then can do well with this drug. Then the other drug where we say people then on the voice about when a hydroxychloroquine. Also now other investigational drug, but it gets so many side effects them. Even the question yourself if it makes sense for like even put anybody on it. So for hydroxychloroquine, so what's in then they use them for? In terms of label indication for like lupus, we be seeing some autoimmune disease where they cause so many symptoms we now like joint pain, inflammation, also like the ESR when the erythrocyte sedimentation rate can become elevated in them people then they but now like then your body affect the good cells them it cause them to forget lupus where we say that then they can really be in so much pain and so many arthritis pain and things like that. So people can take the hydroxychloroquine for that. And also then they give hydroxychloroquine for malaria. No. But then get limitation for the use because why? It gets so much, side effect to them. Like Abidon mentioned, the cardiac effect. It cause some cardiac failure for people. Then also it cause, liver problem. It cause some blood problem then for the forcing way they take the medication. So even though we understand, say, we president of the U.S. in to take this medication right now for himself, the dose usually not like 200 milligrams, and also this particular medication, it cause, renal problem, it cause some GI, meaning, stomach problem. Then where we say if you not take your time, it cause like a perforation, as well as it cause like some skin disorders. Them and some people we get some genetic when a G6PD deficiency and some hematological deficiency, then often take this medication, due to some of the side effects. It can also, somebody will get diabetes. If you take this medication, it can cause severe low blood sugar, and weight can become, life-threatening. So, and can also cause neuromuscular effect. So, as you can see, it just keep going, and also it cause some vision problem them as well for the prudent, as well as psychiatric effects where they cause suicidal behavior. So this definitely not to one of them drug that they where anybody for they recommend or for even they promote, because they do well for the patients, rather they give more problem than they give more problem than the benefits. So what you always say, the benefits have to outweigh the risk for you to use a particular treatment. So because of that, hydroxychloroquine and the Madagascar Cove right now, and also the way to go. But definitely remdesivir in the show so much promising, for the people that we get severe COVID-19. So, and that's one of the things, and then we are picked up from, up to date, and also from Mayo Clinic, the New York State Department of Health, as well as the Royal College of Pediatrics, based in, as well as the clinical trials. So now that I'll be one present, and thank you.
Okay, thank you very much, Isatu. You don't can. I don't know. We a few questions, and but one left you first for go. I will talk small about this face mask enforcement. Then I bring whose friend. Then I believe say we will get you ready back. So make will left you first. Then we go bring you come back later.
All right, thank you.
We do yeah. Waiting we able for process or waiting we able for get out of that presentation day. Whose term or terminology or medication or explanation. I've seen at the comment section of Facebook, people really perfect explanation. We get that's good. People really appreciate when a social network can do. Not so. Then 2 days here we avoid the issue. Then it's a bien. Not the call name. We not the call name the issue. But we avoid them. But this one, I want before the car with whose friend, I just read the press statement we come out from the Motor Drivers and General Transport Workers Union. The Motor Drivers and General Transport Workers Union. This particular one was dated on the 21st of May 2020. To remember, I talked about it yesterday. It's a press release. It's a in the kind way and manner within they try for fully cooperate with other stakeholders then in order for prevent, contain the coronavirus na Sierra Leone, and also the top leadership of the Motor Drivers and General Transport Workers Union. Then they try for appeal to the entire membership nationwide entire membership nationwide, but specifically, they want pinpoint, but they want the within a pack, the executives them, for make them ensure passenger them for use face mask before then they load na any public transport. Before you load na any public transport, then say you for wear face mask. This they come up from Motor Drivers and General Transport Workers Union. Also, then they remind the members them. Then they tell the member them, let the member who then they tell the member them for member for cooperate, for do the total obedience of all the provision them where they don't put inside this public state of emergency. And would that be put on and say make the member say na the president now be put on the 24th of March 2020. Then the one for make the no say the Salon Police, the traffic warden cops go embark the word they use rigid, tough enforcement on Monday, the 25th of May, 2020. They say they want to make Sierra Leone and them be careful of COVID-19 epidemic. And also they want to Sierra Leone and they know say prevention is better than cure. The person will sign am na will sign Combo Koroma and the Deputy Secretary General in charge of operations, Motor Drivers and General Transport Workers Union. The side where me want focus pa, the Sierra Leone Police and the Traffic Warden Corps shall embark on a rigid enforcement on Monday, 25th May, 2020. Motor Drivers Union, na dem police press release. You think saying a Motor Drivers Union and for police particular press release? You feel say their voice heavy for making them pull? Way 2 weeks ago, it's already mandatory for all man for wear face mask where they come na public inside Sierra Leone. From 2 weeks ago. But now, motor drivers say, them with Sierra Leone police and the traffic warden them. Now then go begin for enforce this rigid. You feel say still get weight? I don't know why make we still play with this face mask enforcement. That's what me feel. I feel so we still play with them. The voice system way for really speak up and enforce this. But sometimes drivers union self go able because if it get to start with the drivers and the apprentice first. Because you can't tell me say I know the load if you know where. Not so. You self get for where I'm first. But make I bring us friend, make we hear from him with waiting Isatu lay na table and waiting himself one talk about this face mask. Yes, us friend, you get the platform, sir.
Okay. Thank you very much, Jubule, and thank you for always being at this program here. And I thank also the doctor at the house, Isatu. He don't talk a lot and he don't really establish a lot of facts them about this new mysterious sick. Then just say it look mysterious even from the time of origin. More than talking about multi-system. Because we will not say the human body is made up of systems. You get the cardiovascular system, then at the heart, you get the respiratory, then outside the blow, digestive, then after you eat, urinary, you got the kidney. So their system there, most of the system they affect them. But the system they back get organs, because the organs they make up the system. But I know we'll go down below again from cells, tissue, and so on to organ. But just for let people know, they say multi-system. And then different systems they affect as the two don't enlighten. And the disease itself, now, if you don't do for years back, then they only relate them to this sequel and say you get a similar symptoms them we show on Kawasaki. But we don't go ask why they call them Kawasaki, because we know they get in Kawasaki, Honda. But when you know, say, outside them bike, they didn't pull them outside in Japan. So why they relate this sickness in Kawasaki? Because in 1967, the first can show face na Japan. That are the Kawasaki, not to the multi-system mode. We get just the one we get example. In 1967, discovered in Japan. But at some point, the track and say it come up from northeast of China. That is very Kawasaki sickness we get. Then what have signs that were similar to this multi-inflammatory sick. Then they get for say it come up from China, and a lot of toxic thing when airborne were toxic in some way. So it become a very thing we become concerned. But at present now, the sick way they say it relates to people who then they check they get the sick, yeah, then they check their blood for no, then swabs for no if he then get any positivity in terms of a virus or bacteria. Then they find out say the virus when at this COVID-19 is positive into some of these cases that would they show up this particular multi-system inflammatory syndrome. I feel say it will affect picking them who are underage. But now it also showed to 20 years old and 25-year-old. I believe from what I gave you research here back now, the 20-year-old would have first in San Diego. The second one was the 25-year-old in Long Island. But a pediatrician within New York City University, what they call Langone, I feel say now he flag this up. This pediatrician now just flag that up. But in terms of the way it affects the people, the blood vessels, it make the blood vessels then swell up, like with some other signs the way as a don't give, vomiting, diarrhea, head, neck, and pain. But you will get for wonder, you see why all that here will happen. But we get for know see the infection and they affect the body. And when some people they see them go vomit and get diarrhea, and there's two sides and just one for hold on. In terms of vomiting, the liver always they become affected in most of this because it affects disease as the two in the talk. Anything when a poison and liver they go further. And during this process, it gets something what they call beta. That beta when they put on the liver, where they kill something false, they put that beta there. When that beta there, you get that greenish color when a bile. And that bile they get two characters then. Now, most of the character now one of an emetic drug, like when they see them, they give, because some people they drink poison, they can treat them with emetic drug and they give them that medicine there for it go induce vomiting. So it will pull the poison in belly. So this particular bile here, it get that ability there. Now for that they see they get the ability back for cause back, they drawn your belly back. So then two factors they get them. So they see they vomit, they get diarrhea. Because the infection don't go as far as the liver while inside the fetum. Then at the one part no more. Then the other thing, I think Dr. Jennifer Leiter, one of these pediatricians, we get for mention back, he mentioned, say, well now, then they observe the patient them in a form of a random way. And secondly, we say don't get an UK. But then get few them with a test, they're not showing positive. But a majority of them, na positive cases them, but we not get them boquet. So they just get them like a random. So, but what you know, mommy want for safe, then what they do? Then they do the research. Let them try to see the link. What is the link between this virus, where we don't count what is COVID present now come on China, then with this particular disease, we'll get similar characteristics, which was years ago in 1967 up to 1976, when they see back in Hawaii. If anything, if not this virus don't mutate, it don't come back, but become COVID. Because it can help them back in some of the research in terms of the genetic, because the virus already get RNA. All virus, they get RNA, what they talk about. That acid, that ribonucleic acid, that in cell, in body makeup, you get an acid. You know, get cell layer where they see the cell membrane, the nucleus, the endoplasm, whatever they call it. Some of you get that basic cell idea. You just get a unique form of all viruses. Now, for that, when they say COVID not in a salon, this not in a salon, therefore, noticing when they check a virus, then they use this most common one, the PCR, where they try to amplify. When they amplify now, this nucleic acid, then they look for. Then they get other things that they look for. So they show say this is a virus, this is a bacteria, these are this. So let them believe, say, first, there is an existence of this COVID inside salon and globally. Then the other part, that one that I just want to take up. Then we come now to this area where they talk about this for implement this idea of the masks. But the mask, then when I see many of the people that I don't mention, then when I head there, when they try for say, no, do this, not to the all, it's only the task force was now in a salon, then most of the kind of the media, then they wear a mask. But when some of them, one or two of the top man, then can go like na social media, mainstream media, like AYV or let's say Radio Democracy, then most of the time, not to all of them, then they pull the mask, put out the chin, then begin talk, they forget say the place that enclosed place, we don't know the day. So what I only hope see them go first carry talk to them, they emphasize and tell them, see them for use them before they go can implement them for say now fine. Because the people in back, they're very smart. So man, they even do screenshot. They don't mind for screenshot. That man, the way they in a AYV or somebody, then they begin to pass and say, well, you say this, and this you say. So let them just note that area they will be doing. So then get for emphasize it, then self the user within a closed environment and also within a public place where they know so then they very close to each other. Because I have distance spacing, we will not get that social distance or physical distance. Now, salon will not go the 100%, it could just be mild. Now, rather than they emphasize the use, it's like transportation. They don't go see them go able to allow all man for me. Then go provide a lot of buses or transport. So the fuel we did, then go allow people for travel, but they go see they don't go able for allow let people choke too much. That's when they come on like what we're leading for car inside. It will be difficult for them. So I want to let them say think of that one day, and then we will use the mask back. No, continue for it. Let them use plastic mask. Then they use the cotton with double. Let them use them, pull them. Let no put on a bag. Use a bag. Let not church before. Go church before. You don't know when format did it. And if you can't try for whole and night, they drown up back. That's the way they can't say drown. They tickle you. You don't know which side they go church eye. Because the eye, something like that, how the eye connect to the nose. But if you sit down, go be small. So if you sit down, you do that, you hold your nose tight, then you blow like air inwardly. You will begin feel a sign say like air they escape between your nose for kind of your eye. Because there's a connection there. What did they? You see, there is connection there, the small air space that did it. What they make the air they go in the eye. So there is a possibility that the virus will travel it cannot respiratory system that it go inside because a light membrane then did it. You see, so that one number one, let them say think say, well, how would they use the mask, not use it the right way, then we can implement the idea, now we know say the implementer in the area where we know say who it go effective. Like it not can be like a situation where I don't see not to the same one like this place na Hong Kong. Right now they get a big demonstration the way the UN don't interfere for certain things them. Wouldn't say enough for do while this lockdown day. So outside body they interfere. The riots they come, they say we not for do this. I'm not saying it will happen as alone, but in terms of this state of emergency, with the type of civil unrest with the type of people that we get, wouldn't they try for educate for against this civil unrest, then we know, but say we not for the take civil unrest. With una yourself, when they help some clip, and no say, if somebody can't say go first, don't go first. But say that time they go reach, let them know back how they bring in ideas them, will not go make people then become very revoltive while then they come back the late. Because that will cause the economy back a problem. Then I may own take inside this small talk here.
And before I let you forgo, Usfin, because I see on social media, we get few people where they champion for people not for wearing masks. Then get some pictures and say people I think some people be wearing and they jog, they exercise, they faint. Some other people begin pull rash. Some other people like you have this different people so like then the campaign say no, people are not for wearing masks, and now the enforcement they come. You understand? And there should be an explanation for, I don't say they can do them, but I don't think say they do them that kind of way for make people really understand. To me, now so me feel. Because now when you see people they don't begin say no, why they for wearing masks? You see some people if somebody team up in one green, if they talk you wear the mask and say, why make you wear the mask? Pull on, you want green team up the. So you see like some of this issue about the mask people in the question. So how you feel say we for really able for pass this message, make people know, because government say as long as you come public place, you for put on your mask. Yeah, a lot of people, yourself can see, they say, oh, me, I forget them. Some man go say uncomfortable, unable. How can we get people for wear this mask?
One thing where I feel say that they suspect, we try to suggest to them 2-3 few things. Are they even fair, say, even themselves, now, one thing about, it's not like, sleep. This sleep, you get for an average sleep of 7 to 8 hours, at least 6 to 7 hours. If you not get sleep, it causes you a lot of problem. You become more stressful if you're able to control that situation. And I realized today of these past few days, during the media, they even ask some of them, then they start to become annoyed, and they be annoyed because there is no time for them to sleep, and they get this thing 7 days a week. But I don't feel say it's suitable for them for say, well, let we sleep fine, let we find a time in the day, if not even time, let we begin to do updates. Or let find any way we will do this update. Then one thing that I suspect from them. But in looking at this area, what they not get, I don't know if their own team, would they as the task force, if they get any psychosocial somebody who specializes in mental situation, because like today, yesterday now, yesterday, now a day when it's a mental awareness. If then they get somebody for advise how to deal with certain situations in this type of situation, so that they don't go cause problems. So people go different. You don't know ask them why they go vex, don't ask them why they vex. But another one day I want them involved. What I bring to social, if they go get them people and then dispatch them at the community, not only in the hospital, and also they don't get boku psychology, mental nurses there, but they get other area where they do social studies or social something. So then social workers then go incorporate them, train them like how they can train this other new task force them, like them and they do for use the how they call it the ventilators and other people like for stand by. Then go find people and then go add up to the number, go to the communities, and even when they come during presentation, then go explain the psychology behind it. Because somebody for come up from one stage to another is very difficult. Just like somebody would smoke a packet of cigarettes for a day, 20 sticks. If you can't tell and say stop for smoke, he really stop that moment day. Before, if not to all, between 1 month, if that person they just stop abruptly. And also every one of them, but there are people who they get what they call withdrawal syndrome, with a very, very bad effect. Because that nicotine don't become part of her, even though it's been bad to her, but it don't become part of her as a being for the time being. So then they tell her, begin take 10. From 20, take 5. You come back from 5, take 2. Take 1, then finally you quit. So they get to know how they bring this idea inside, how bring this illustration, how they will bring that. They don't just can't impose them, because everything is systematic. We're not saying an emergency, but let them find a gradual way somebody will can explain to them, say, this is difficult, this is difficult, like a counseling. Now, so una go do. Una not wear mask will go so tight enough. Then one place. Find one way we say it cushion your nose will not go so irritate you. So I get used to them. Or if you even day now yourself, find like 2-3 hours. Say you get 3 masks, just use one as an experiment. Certain time in the night, you use them. So you go just get used to them. So that when they come out of the public, now the one will not be the experiment to put aside because no effect. Then the one will be clean or you take and you come out. All those ideas, just implement them, introduce them. Because if you just can't say begin use and man not and use masks. These are people that are surgeons or doctors or people who are exposed to health hazards. And then they use them. So if they can't just begin to say all man they wear masks, it will be very difficult. And again, that's people they tell we say, not use this N95 mask. Now, because sometimes when they don't donate, sometimes the donation come, and the best mask they were less and they grab them, they take and they wear them. But at some point, they said they get issues. And then they advise you not for use N95. Let them use this. But now they see themselves, they use some of them. You see, so then they get like that tube, that long one. All those are not masks. One the way they see like that bug moth like so. Not to mask for this type of thing. Now one will just flat over your nose. Because it seal everything. But when they seal, I know they seal them at an airtight way, so tight, it just they allow you for like you breathe out and in. But when they breathe in, there is a less tendency for less particles and pass when they go infect the other outside person or if they come through you, the outside can you lose. And then logically all like for try no. Because not to see what people then use. Other thing and they will then go introduce, people then go accept. And that's systematic. Now, you know, mommy, please, I will try and find a way again. Would that message will relate to them? Would then go to understand? Instead of them come with stringent measures, can begin give fine to people. Way behind the door, some of them know they do them. And I even see a clip. I don't know if now other year, but I will find out. Then they have people in back they can the social media, what they can give, what they can, what are presenters. But the person now, you know, the presenter, and I'm more na social somebody. Then what they say, not do birthday, not do this. So I see the day. I don't know if the person has mistake on our years back, but now this is the look, the person in Facebook status. I see the people and they dance, and what I see that the main presenter of a certain social mainstream media. But I don't know if that this year or not last year, because I'm not sure date. I'm not going to decide. But I will see if I can able to find out that question. But I left that side. All I type was those who are saying things, they have to do them. We are not perfect. But if we don't want to do them, let we show how people they get for do and for understand now. But the only thing with this statistic, if they not do them, they say, well, you do them. It's difficult because it's a sequel they spread. Somebody not look symptomatic, it still spread the disease. So we'll give advice, let everybody use them in a sealed place for now or outside place. Because that oxygen style address them. Now that one day that talk so now that side day, it's truthful. That I've been talked to one day, I mentioned to today. There is a truth behind the idea of using masks where it tight for you, where it is for them. Because you need oxygen for your brain. You need oxygen where they go now your lungs. So if you get a get collapse now because of the oxygen not this tight, so you got to use the right mask. And then they got to show the people are using the right mask. Rashes because some people then are plastic like thing, and plastic somebody then allergic to Rauna latex. Not to all people are allergic. So those are the few people. So instead of the one they shouldn't don't use this. Now so if you use them, so you summarize. Then I'm your own take. Yeah.
Thank you very much. Thank you very much.
Thank you.
Usfend,
yeah. God bless. Yeah. Okay, bye. Yeah.
Yes, caller, your name and who side you call from, please?
Hello, Nami, to talk to?
Yes, sir.
Okay. Didn't I see Square call from Australia?
Yes, it's Square. Get the platform.
I observed something, yeah. Mm-hmm. Yeah, I observed something, though I sent message na AYV on the interview, but I'm not able to read them because I get so much messages them. The Minister of Information, the phone for the Engie mask halfway. So, and if then they preach this message, we only tell them people, they have said this sick day, this day, when they go so now they spend money for the coronavirus and everything, when I really need for the lead by example. You Minister of Information are going to go na AYV. Watch all them most of the interview the way they go na AYV. The mask they hang halfway. So waiting and they tell we, you Minister of Information. Then sometimes you can just behave arrogantly and they ask a question and then they answer to the question. They jump what you want to talk now they do. You know, like this thing seriously, we leaders they really need for preach the message and they do the right thing. Let them do waiting and they preach. Let them do waiting the health and practitioners and they preach. What then they tell and let them do and let them not behave like how Donald Trump they behave. Let them behave, let them respond to what the health people and they say. If they say no do this, no do them. You minister not going to go to on television, the angry mask, pull him out now do the talk, then the other presenters then wear them. If you went and say they wear the mask, you know they agree wear them. You know, like we really need to be serious about what they do. Especially with leaders them. It will start from them. Then we will talk about the youth. So what do you want for say about the youth? What the leaders they know they do the right thing. When you want for straight something AAA, if it's not yours, you want for tell, hey, nobody know for do this. Nobody know do this. So you, Papa, you begin to do certain things the way you know say no ethical. Where you know say you don't talk, say nobody know for do them. So you begin to do them. Thank you very much. I thank Isatu and this we other brother we enlighten me. We learn a lot from it. Thank you very much for that. For even then come for we and at least yeah. Thank you very much.
Thank you, Cisco. Thank you, sir. Make we go through some of the messages them. But I think most of the messages them are in support of waiting Isatu be the talk. Dave Kitty, he say me just want to a little bit of humor. He said today now the nurse them, the doctors them, and the students them where they inside the healthcare profession. He said now they more profit. And he want to tell thank you to Dr. Isatu Kakay-Diallo for the information. On the mask side, we get Fatme Fatu Awanatu. He say if they provide the free mask for people them, then everyone go wear them. He say maybe then they go help. However, I don't know, Fatma, if you don't see where we camera can work. Most of the people, them, now few people go tell you, say, they no get face mask. But most go tell you, say, they get them, but they left in a house. Or they forget them. Yeah, few say they no get, but most get, then go tell you, say, now forget them. So for the one day we get them, most people will get them. We know they use them. So even if they provide for everybody, but their intent for one for wear them for daily. And we also they talk about the N95 mask. So yeah, Fatima said the one for Concourse say the N95 not the best. And now then they use in a clinical setting. But the big allergy themselves na tongue, to themselves they able learn par now, so and themselves they use now mostly, they know they use again the cloth mask way before at one time a lot of everybody, including the big one and I them be the way. A lot of messages that will come now in support and in agreement with waiting is say, yes, Isatu. You get a platform.
Okay, thank you very much. And thanks to all those that commented on Facebook. And I hope the information we present here today is helpful to the public as well as, to the parents them for the make sure that they monitor the Pekin then we then begin present with some of the symptoms and we COVID-19, the fever, the cough, the rash, the redness, the moths, we be saying the strawberry tongue and like peeling of the hands, we be saying a presentation for the Kawasaki disease. And as to the question where George Kamara they talk about, say whether or not JVD when a jugular vein distension, we say excuse me, the neck vein can swell up, that is like a symptom or manifestation of a cardiogenic shock. So we say, the heart, no get some impairment or maybe the heart not able to pump blood supply to the organs them. So when that happens, the patient can present with, shortness of breath, the cool clammy skin, meaning the hands and the feet then can become cold. Sometimes then they can become loss of conscious, because of the lack of blood supply and nutrients to the vital organs. So then due to the cardiogenic shock, as well as then can get very little urine output, because, you need the blood flow, for circulate through all the other organs. So it's very important for say, this multi-system inflammatory syndrome can begin them get the cardiac complications, because when they say multi, we already know what that means, meaning a multiple system them where they affect, but it mainly they affect, the heart, the respiratory, as well as, and the liver, where we say, the markers and the inflammatory markers then can become elevated when the C-reactive protein, the erythrocyte sedimentation rate. So we then do the blood test. Then there are soon as special markers. They're not just like you do a blood test for see whether you're anemic or something like that. But this also can show say you're anemic, but like there are other markers and then go for other than like special test them, and then they find out say the numbers then can very elevated, so with that elevation then they can come to a conclusion for make sure say they seek out the right, specialists then for come on board when rheumatology as well as cardiology and hematology, all them special, physicians then, can come on board for make sure so they treat the patient, and cases like these then can tend to be like in the intensive care unit, with the Kawasaki, like I mentioned, then definitely need for try for implement treatment within 7 to 10 days, because if the person don't get persistent fever more than, 5 days with no other explanation as to why the fever they happen, then definitely go benefit from the prompt, intervention for ensure the problem not will get out of hand, and, also, the social distancing, the mask wearing, we be say picking and waking left for the play dates, we would live now overseas. Sometimes they really say, I want to have a play date or sleepover or something like that. And obviously this is not the right time for all the encouragement and even the one them, where if they really insist on doing that 6 feet or more, then they really recommend Andy for picking them. And pregnant woman then we get picking with them. Let them become aware of the picking and be careful as to knowing that if you get the illness picking near you most likely can contract the virus that way. So now some of the recommendations. And I know say my parents that with the breastfeed and concerned whether the COVID-19, then at the breast milk, really they don't see anything with that, but only if the environment where you did, if clean, they not like a place where the virus they, then you at risk for that the virus come in contact, where they feed the pikin, especially if they pump the breast milk, put on a fridge and things like that. But you need to really follow all the different precautions and we take care of, not picking food and things like that. And then myalgia, where we say now like muscle ache, body aches, loss of taste or smell, now some new symptoms them we don't come with COVID-19, some of them and they can also happen. And other symptoms that we begin can present now the sore throat, nasal congestion, diarrhea and vomiting, then and they need for you to keep an eye for see what's in the beginning complain about. Fever and cough definitely are the most common symptoms we picking and they present with, so down there you just keep an eye on it, and I make, if they monitor the picking temperature, you don't get Tylenol, say really improve, sit down, just go to the pediatrician and see how best and able for, take care of the kid. And then, rash as well as, that strawberry tongue, then in a hallmark sign for Kawasaki disease, and picking them way really now from the Asian descent, we say then they get more, mean say, other generation, not they get other descent, not they get it's just that, they see more in them people than they pass any other population. prevention definitely is the key here. People then we get this, then they hydrate them, then they give them some inflammatory support system, as well as, some antiviral, depending on the severity of the illness. If not like moderate, to mild, they can just do like supportive care. But when are critical and severe, then they advocate for the antiviral drug, where we say now the remdesivir, in promising results for the adult population. We don't take them compared to hydroxychloroquine, where we say it gets so many side effects, and you therefore be very careful as to whether that medication was being on the market. Something really affect your heart, your liver, your kidney, your eye, your skin, and many others, are concerning one, and are not feel in a drug wolf, or even they promote, or even they advise for that and use them, because they use them before for malaria, lupus, and all that. Yes, the effect on that because now for the inflammatory response. But we come to this particular virus, and knowing all that side effects and knowing that people can suffer from underlying medical conditions, it's not a good idea for put them on that. Actually, somebody will get kidney problem, will get liver problem or heart condition. If you do that, you just increase the person risk for get sicker. And also, the clinical trials is definitely needed for, Madagascar, and also say we get any problem with things that really happen now, and we African continent, we go definitely want to use anything from the African continent, but, the study really show, promising results for, say, we don't go through phase 1 clinical trials, we don't give this amount of people, then this amount of dose, this amount of amount, they don't take this, and then they do well, they get less side effect, down there you put it on paper. I'm sure anybody can look at that and see, what, it makes sense for I use this particular drug here. But without that, and obviously not the way to go right now. And I think, say, it makes sense for that and do more study, and then once the study is out, then get evidence for, say, the medication or the drug would don't come up with the effective and is safe, then it makes sense, because as we know, some clinical trials, people can really die from it, and then, we don't want that. Sometimes in the African medications that we can give it and just say, drink this cup here. So, maybe say, a lot of medication, if you really study in a lab, maybe like how many more than 3,000 milligrams of medication, then the maximum daily dose for you take, you get limit. For Tylenol, for example, we can take Tylenol for headaches. The maximum daily amount of Tylenol na 3,000 milligrams. Before now been 4,000 milligrams. So then decrease to 3,000 milligrams, because then we just take them, more if they cause so much liver problem, because now one of the side effects of that you see, say the patient not get no liver problem, but then they're not take Tylenol so long, and then they come out and check to see what really causing the inflammation of the liver, then kind of find out, see the patient, they take Tylenol like every 4 hours, that they take like 2, 3, depending on how the person gets ill. We do not seek medical problem for them exact condition for that condition, they, help. The key here for this inflammatory, multi-system inflammatory syndrome in children, now for ensure, say, the healthcare provider and them aware of, how to take care of the picking them, especially the clinicians them, for no say, where the picking don't present with them symptoms there, you try for rule out any other, infection, where you don't rule down out the blood, the inflammatory tumor, inflammatory markers when are the elevated, C-reactive protein, ESR, the ferritin, the D-dimer. Then all you don't do them labs there. So based on that finding, you for seek prompt, specialist intervention to make sure, say, you can keep the patient safe, from complications. I think as far as I know, now take down there for tonight. And when it comes to the mask, just briefly, I want to say yes, I agree. Say the people in the country, where we say they're not like a role model, where we say they're not elected officials, it makes sense when you wear the mask. You try to wear the mask when you talk, them masks, they're in a cloth mask. The N95, now one of them masks, and we say then they then they do a fit testing and get two sizes and get regular and a small. So that particular mask, you forget the correct size. If you not get the correct size, then, they do yourself justice. They do the actual prevention any justice. But for put the mask down, because, they get difficulty breathing, I doubt that, because even if you take an example, you put on your clothes, over your nose, somehow, some way, they get some kind of breathing, in and out, but the goal is so you talk, where you cough or you sneeze, like the virus not spread and reach by the other person. So I think, say, let we put them at the country, especially those that, they go preach to other people and say, now for do this are the measures and we don't put in place. Then for be the example for let them follow that day. So now that I feel, say, I will want to tell everybody, and we hope, say, we get more, things them for constantly educate people on how to, prevent themselves from this virus. The number are very scary, but we hope for the best.
Thank you very much, Dr. Isatu Kakay-Diallo. Thank you.
Thank you.
Well, I think, say, we don't come to the end of today's program. And with all the confirmation they will get on Facebook, people appreciate the information shared. Also, we'll lock today on program. It's Friday. We hope for the best for tomorrow. Till we meet again, Triple A, Tata.